This presentation will cover accreditation agencies and the survey process. It will also discuss what tools are used to address documentation in the medical record and healthcare organizations. The American Osteopathic Association's Healthcare Facilities Accreditation Program, or HFAP for short, was implemented originally to make sure that osteopathic students received training in facilities that provided high-quality patient care. As a side note, osteopathic physicians have the DO credential after their name. The AOA received deemed authority to survey hospitals under the Medicare Conditions of Participation. As mentioned in a previous presentation, deemed authority means that an accrediting organization's standards have met or exceeded CMS's Conditions of Participation for Medicare certification. Accredited facilities are eligible for reimbursement under Medicare and Medicaid, and CMS does not have to conduct a survey of its own. HFAP also has standards similar to the Joint Commission. When a healthcare organization is interested in becoming accredited by HFAP, they must first study the accreditation requirements. This should be done about 6 months ahead of application submission. This also allows the organization to see if they are meeting the standards or if they need to put performance improvement activities in place to meet the standards. After review of a submitted application, HFAP will schedule an on-site visit with the facility to survey if in fact they are meeting all standards. After becoming accredited, a facility will be visited at least once every 3 years in order to maintain their accreditation status. FHAP has a patient-centered methodology. This means they place an emphasis on the patient at the center of all health-related activities. This slide shows an illustration of the methodology. This care, access, review, and evaluation is how they survey facilities. They look at each area involving the patient and give a score based on their findings. They will look at reports and compare data to other type facilities, review documentation and medical records, perform chart audits, look for evidence-based guidelines and best practices as to what is working well, interview staff, physicians, and patients, as well as directly observing how patients are receiving care. All of this combined leads to the care methodology. The National Committee for Quality Assurance, or NCQA, is a private, not-for-profit organization established to assess and report on the quality of managed care patients. This organization created a tool called the Health Plan Employer Data and Information Set, or HIDIS for short, HEDIS, which is used to collect data about the quality of care and service they provide. The NCQA standards are listed on this slide and include patient safety, confidentiality, member satisfaction, access to services, service quality, and continuous improvement. Former President George W. Bush established the Office of the National Coordinator of Health Information Technology, ONC, under the U.S. Department of Health and Human Services. Its purpose is to 1. Build a national health information network. 2. Reduce medical errors through technology. 3. Improve quality of healthcare services. And 4. Produce greater value for healthcare expenditures. President Barack Obama identified the Electronic Health Record, or EHR, as a priority of his administration and signed the HITECH Act. HITECH stands for Health Information Technology for Economic and Clinical Health Act. This act promotes the widespread adoption of EHRs and allows incentive payments from the government for those using a certified EHR technology. Financial penalties will occur for those that do not use a certified EHR when that time comes. There are required components or standards that must be met in order to meet all areas of the HITECH Act. The different areas will phase in as the years progress. They are included on this slide. Standards in health IT products, privacy and security policies, National Health Information Network, as listed on the previous slide, adoption of interoperable health IT, and governance to coordinate all the pieces, which is all the purpose of the HITECH Act. This slide is a continuation of the health informatics standards that will be required with the HITECH Act. The standards on this slide are specifically information technology, IT, standards and definitions that must be considered when developing a national health information network. We need standards for vocabulary, structure and content, transactions and messaging, security, and identifier standards. The definitions are listed on this slide as well. When you discuss data standards, you must also discuss data sets. They both go hand in hand. The National Committee on Vital and Health Statistics is one of the leading organizations that has called for increased efforts to develop standardized data sets for an electronic environment. The data sets used in the paper environment will be outdated when EHRs are widely in use. Shifting gears in this presentation, there are other tools used in healthcare facilities that help to establish how documentation in the medical record will be handled. We refer to policies and procedures for this type information. In more simple terms, a policy is what is required and a procedure is how to do it. Another way to put it is a policy is the rule, while a procedure is the steps involved. These two often get confused, but they are very different, as you can see based on the definitions on this slide. The medical staff in a healthcare facility creates and votes on bylaws, rules, and regulations. Bylaws are policies that delineate medical staff responsibilities. Rules and regulations are procedures that clarify the bylaws. Members of the medical staff must review the bylaws, rules, and regulations as part of their recredentialing process. Bylaws, rules, and regulations can be updated as needed with approval by the Medical Executive Committee. The Medical Executive Committee is made up of members from the medical staff, hospital administration, and various clinical departments. This committee, as well as many others in an organization, are central to a facility's activities and provide a forum during which decisions are made that impact the entire organization. All committees must be structured so they are organized and the members work well together. They are chaired by one person that is responsible for overseeing all activities of that particular committee. The purpose of the committee will determine the structure. Committees can be formal or informal, but all members must actively participate. Most hospitals have a medical records committee that oversees all documentation requirements for the patient medical record. The committee monitors the quality and integrity of all documentation. They also decide what is required in each patient record and recommend a format or chart order for the record. Most importantly, the committee recommends actions for physicians with delinquent medical records. The number of delinquent medical records, along with the responsible physician, is reported in this committee, along with being reported to hospital administration. That concludes this presentation.